The axillary nerve block is performed very commonly because it's fairly easy to do. You just not need to make sure you get all the branches, and you need to get the muscocutaneous nerve, which is in the coracobrachialis muscle, superior to the pulsation of the axillary artery, 90 degrees to the skin. So when I used to do this, we before ultrasound, we would palpate the artery, we would aspirate blood. When you go past the artery, the blood aspiration ceases and you would inject, getting the radial nerve, pull back, aspirate the blood again, pull back a little more. When the aspiration ceases, you would inject more. Of course, it would be harder to get the coracobrachialis muscle identified and the muscocutaneous nerve, so we would do a cuff of anesthesia on the upper arm and you hope for the best. But now with ultrasound, you have a lot more options. Okay, so this is the position. Patient would be lying down, hand out to the side, and you put the probe right in the axilla and you go superior to the probe or more superficial. Remember, the artery will collapse with pressure. Lateral to the artery, you have the median nerve. On the other side of the artery, deeper to the artery is radial nerve once again, and the ulnar nerve lies more medial. Here's a quick video. And there's a muscocutaneous nerve. Okay, so the image of the ultrasound on the model in this picture is not completely exactly how I would do it. It's more like this, not really like this. Okay, so you're coming in like this. I'm not sure if you see that. Okay, once again, the humerus is the bone, hyperechoic bone with the darker shadow behind it. Here's my needle. The muscocutaneous nerve is over here. Okay, this is just an overview of the nerves in the upper extremity. Okay, keep in mind, here's your lateral pectoral nerve. Okay, we're going to talk about that later when we get into the PEX block. Coracobrachialis muscle. The medial pectoral nerve also is something we're going to discuss with the PEX block later on. Muscocutaneous nerve, coracobrachialis muscle under the biceps here. And then the brachial plexus, some people are anesthetizing it in the mid-axillary, in the mid-humerus region for various reasons. You have here the radial nerve coming down, running under the brachioradialis muscle. You have the median nerve running next to the artery in the cubital fossa. This is a nerve that gets injured when people are doing IVs. I've seen some cases of CRPS from that or complex regional pain syndrome. Here's the ulnar nerve, which can be entrapped. We'll get into all that very soon.